All right, so are you ready to totally crush that hospital pharmacist interview?
Crazy bet.
We're here to help you do just that today. We're going to dive into some of those tricky questions you might get hit with.
Give you the inside scoop on what those hiring managers are really looking for.
And guess what? We've got some amazing resources from RoleCatcher, which is this super cool career development platform.
They're going to give you like a secret weapon for this interview.
So you'll be walking in there feeling super confident and prepared.
Totally. Because remember, being a hospital pharmacist is so much more than just, filling prescriptions.
Right.
You're a vital part of the whole healthcare team.
Yeah.
You're working side by side with doctors and nurses.
It's all about patient safety.
Yeah.
Yeah.
Making sure those patients get the best possible outcomes.
Okay, so let's jump right into it. Our first question comes straight from RoleCatcher's interview guide. And it is, can you tell me about your experience working with medication dispensing systems? I'm thinking back to my pharmacy school days, and I don't remember spending too much time hanging out by the vending machine.
You're telling me. I mean, they want to hear about those fancy automated dispensing systems you see in hospitals.
Right.
These systems are like the brains of the operation, They keep track of all the medications, make sure everything's accurate.
Yeah.
So they want to know that you can handle the tech side of things.
So how do you answer this one, even if you haven't actually used that specific system before?
Honesty is always the best policy. But instead of just saying, like, nope, no experience, you want to focus on those skills that can transfer over,
Right.
So think about it. Did you maybe manage inventory at a retail pharmacy?
Or were you like a rock star at learning new software in a previous job?
Exactly. Connect the dots for them. Show them how your past experiences make you a quick learner.
That's a great point. And you know what else? RoleCatcher actually has this really cool AI feature. It can analyze your resume and suggest specific skills to highlight based on the job description. Pretty cool.
It is. And it can even tailor your answers and give you feedback on how to fine tune them, which is incredibly helpful, to make sure you're really showcasing your strengths.
Totally.
Now, another question you might get is, how do you ensure accurate medication dosing and administration?
Ooh, this one sounds like they're really digging into that attention to detail.
For sure.
I bet they want to hear about more than just, following the doctor's orders.
Absolutely. It's all about showing them that you are totally committed to patient safety. They want to see that you're verifying those orders, calculating dosages carefully, considering things like the patient's age and weight allergies,
Right.
drug interactions, all that good stuff.
It's like being a medication detective.
Right. You got to be on the lookout for anything that could cause a problem.
Yeah.
So walk them through your process step by step, how you double check everything. What resources do you use to confirm the information?
Yeah.
Do you involve other healthcare professionals? You got to paint that picture for them.
And RoleCatcher actually gives a great sample response for this one. I always verify the medication order against the patient's chart and double-check the dosage and route of administration.
Perfect.
I also consider any potential interactions or allergies and consult with the prescribing physician if I have any concerns.
Exactly.
So you can use this as a starting point, tailor it to fit your own experience.
Now, here's one that can be a little tricky. How do you manage conflicts with physicians or other healthcare providers over medication orders?
Oh, yeah.
Because, conflicts do happen in a busy hospital.
I do.
And they want to know you can handle them like a pro,
Yeah.
professionally.
This feels like a tough one. It's all about finding that balance.
Yeah.
You want to advocate for patient safety, but also maintain those good working relationships with the whole healthcare team.
You hit it right on the head. It's a delicate balance, for sure. The best way to answer this one is with this specific example. Think about a time when you successfully resolved a conflict. How did you communicate? Did you use those active listening skills? How did you ensure that the patient's well-being stayed the top priority?
That's so important. And remember, no naming names or giving away any confidential information. Just focus on the process and the positive outcome.
Right.
What I think is really cool is that RoleCatcher's AI can actually give you feedback on how you frame your answer.
Oh, wow.
Helping you strike that perfect balance.
So helpful.
Yeah.
It can even suggest follow-up questions that you could ask the interviewer.
That's interesting.
So, for example, after you've talked about how you resolved a conflict, you could ask, what systems are in place here to facilitate clear communication between pharmacists and physicians?
Oh, that's a smart strategy.
Shows you're thinking ahead about teamwork and how to make things run smoothly.
Shows you're a problem solver.
Exactly.
Okay, let's move on to a question that's all about keeping up with those constantly changing advancements in pharmacy. how do you stay up to date with the latest developments in pharmacy practice?
Right.
We all know that, like, reading journals is the classic answer.
It is.
But how do we make it stand out, make it a little more interesting?
You have to be specific, Show them you're truly engaged. Mention the actual journals you follow, conferences you've attended, professional organizations you're a member of.
Uh-huh.
It paints a picture of you being proactive and passionate about what you do.
And you know what RoleCatcher recommends? Joining organizations like the American Society of Health System Pharmacists, or ASHP.
Great one.
They offer a ton of resources for, like, continuing education, networking opportunities.
Definitely.
They can really help you stay ahead of the curve in pharmacy.
Yeah, absolutely.
Plus, it shows initiative, which is huge during a job search.
Huge. Think about it demonstrating that you're a lifelong learner is key to any healthcare career.
Yeah.
Especially in a fast-paced environment like a hospital where things are always changing. So true. Okay, ready for a question that tests your knowledge about a specific type of medication?
Hit me.
All right, here it is. Can you explain your process for managing high-risk medications such as opioids or anticoagulants?
Oh, yeah. These are the ones where you got to be extra careful.
Right.
Because if they're not handled properly, there can be some serious side effects.
Exactly. So the interviewer wants to see that you understand the extra precautions these medications require.
They want to know you have systems in place to prevent any errors.
Yeah.
And that you're totally focused on patient safety.
So it's about going beyond the basics of just dispensing the meds.
Yes.
It's about showing them that you're thinking several steps ahead.
Exactly. You got to emphasize that verification process.
Right.
Explain how you double-check those orders, ensure secure storage, and follow all the hospital protocols meticulously.
Like you're following a recipe, but with life-saving ingredients.
Right.
And RoleCatcher suggests mentioning specific strategies like double-checking your calculations with another pharmacist.
Or using those automated dispensing systems that have built-in safety features.
Good ones.
What I find really helpful is that RoleCatcher breaks down the why behind each suggestion.
That's great.
It helps you understand the reasoning.
Yeah.
So you can really tailor your answer.
Yeah, and you can also talk about your experience counseling patients on these high-risk medications.
Oh, yeah.
Highlighting your dedication to clear communication.
Yeah.
Patient education.
So you're showing them you're not just checking boxes. You're truly advocating for patient safety.
Exactly.
Especially with these medications that require that extra level of care.
Now, before we move on to some more questions, let's take a quick look at what the career guide, Hospital Pharmacist from RoleCatcher has to say about getting started in this field.
Because landing that first job is all about having the right experience right.
It is. The guide highlights how important internships or rotations are during your pharmacy program.
Right.
Think about volunteering at a hospital pharmacy. It's a fantastic way to gain experience.
Yeah.
And start building your network.
And even a part-time job in, like, a related setting
Right.
can make a big difference.
Absolutely.
It shows you're dedicated and you're willing to go that extra mile.
For sure. Welcome back. Before we jump into more of those interview questions, I want to touch on a really important point from RoleCatcher's career guide.
Oh, yeah. With that?
It's all about how you present your experience, making sure it really resonates with those hiring managers.
Right, because anybody can just, like, rattle off textbook answers.
Exactly.
But it's about showing them you can actually apply that knowledge in real-life situations.
That's what they want to see.
Yeah.
And the guide suggests using what they call the STAR method.
STAR method.
It stands for Situation, Task, Action, and Result.
Okay.
This framework basically helps you tell your story in a clear, concise, and compelling way.
Oh, that's a great tip. So it helps you create a narrative that really highlights your skills and accomplishments.
Precisely.
Make those answers more impactful and memorable.
For sure. Speaking of impactful, let's tackle a question that needs a cool head and a systematic approach. How do you prioritize your workload when dealing with multiple medication orders and requests? Think about it's like organized chaos in a hospital.
Oh, totally. It's a constant flow of information and requests.
Right.
Got to be on your toes.
And the interviewer wants to see that you can handle that pressure, that you can make those tough decisions quickly and efficiently.
Yeah, they want to know you're not going to crack under pressure.
Right. They're looking for someone who can juggle those urgent needs while keeping everything running smoothly.
So how do we show them that we're not just frantically multitasking, but that we have a strategic approach to managing all those demands?
Okay, so you want to describe your process for triaging those tasks.
Okay.
How do you figure out which orders need attention right away?
Mm-hmm.
How do you prioritize?
Mm-hmm.
Do you have a system for tracking your progress? Do you use any tools like those electronic task management systems?
Oh, yeah. Or even just a good old-fashioned to-do list.
Exactly. Anything that helps you stay organized.
Right.
And RoleCatcher's Guide really emphasizes this. Make sure you're communicating clearly with the whole healthcare team.
Right.
If there's going to be a delay or you need help, let them know. It's all about teamwork.
Yeah, it's about working together to make sure that patient care is seamless.
Exactly. Collaboration is key. And being proactive in your communication really shows you understand that.
For sure.
Okay, let's move on to a question that touches on a sensitive but really crucial part of healthcare. How do you ensure that patient information is kept confidential and secure?
Ooh, this one seems pretty straightforward, but I'm guessing they're looking for more than just, I follow HIPAA.
Right, you got to go deeper than that.
Yeah.
It's about showing a genuine commitment to protecting patient privacy.
So how do we do that?
Walk them through the steps you take. How do you make sure those physical documents are secure? Do you password protect those electronic records? Are you careful about conversations you have, out in the open?
Right.
You want to highlight your understanding of how sensitive medical information is.
And I think it's really helpful that RoleCatcher's AI can suggest ways to personalize those answers.
Oh, yeah. How so?
So, for example, you could mention any training you've had on data security or privacy protocols.
Right.
Shows you're really proactive about staying informed.
Love that.
Okay, so let's dive into a question that gets to the heart of what a hospital pharmacist does. How do you ensure that medication orders are processed accurately and efficiently?
This one's all about precision.
Right.
Having those checks and balances in place.
Because in healthcare, even a tiny error can have big consequences.
Right.
So they want to be confident that you have a system for preventing mistakes.
Exactly.
That you're not cutting corners.
So start by explaining that verification process.
Okay.
How do you compare the order to the patient's chart? Do you double check the medication, the dosage, the route of administration? What about allergies, potential interactions?
Yeah, it's like a multi-point inspection. You want to catch any potential issues. And RoleCatcher's sample responses emphasize those things, like using barcode scanning technology.
Right.
And having another pharmacist verify those high-risk medications.
Those are great examples.
Shows you're serious about accuracy.
Absolutely.
You can also talk about ways to make the ordering process more efficient without sacrificing accuracy, of course.
For sure.
Like, are you familiar with electronic prescribing systems?
Yeah, those are great.
Have you implemented systems to reduce errors?
Right.
Okay, ready for a little logistical puzzle?
Hit me.
Here's a question that tests your inventory management skills. Can you describe your experience managing inventory and ordering medications?
Our inventory management.
It's all about keeping that pharmacy stocked up,
Uh-huh.
but not overspending or running out of those critical medications.
Right. It's a balancing act for sure.
It is. So talk about your experience with different ordering systems, inventory tracking methods.
Uh-huh.
You know, those strategies for forecasting demand.
Right.
Have you ever had to negotiate with suppliers or find those cost-effective alternatives?
Yeah, that's a good one to mention. Shows you're resourceful.
Exactly. And RoleCatcher points out something I think is really important.
What's that?
Understanding medication expiration dates and having systems in place to minimize waste.
Oh, that's huge.
Right, because that shows you're mindful of efficiency and the financial side of things too.
Absolutely. Now, for a question, that might seem basic, but it's a chance to show off your passion. Why did you choose a career as a hospital pharmacist?
Yeah, this is your time to shine.
Exactly.
Show them you're not just there for a paycheck.
Right, you're there for a fulfilling career.
You want to make a real difference.
It's about showcasing your genuine enthusiasm.
Right.
And connecting it to your values.
So it's not just saying things like, I like science, or I want to help people.
No, you got to go deeper.
Right.
What specifically draws you to a hospital setting? Is it that fast-paced environment?
Or the opportunity to work with such a diverse team of healthcare professionals.
Right. Do you love being a patient advocate?
Yeah.
Let them know.
And you know what RoleCatcher's AI can actually do? It can help you tailor your answer to align with the specific hospital's mission and values.
Oh, wow, that's amazing.
Right. It shows you've done your research.
And that you're a good fit.
Yeah.
You can also share personal stories.
Oh, yeah.
Maybe you saw firsthand how a compassionate pharmacist helped a family member. Or maybe you volunteered at a hospital pharmacy and you were just inspired by the impact they have.
Right.
Those personal touches can make your answer really stand out.
Show them you're truly invested in this career path.
Exactly.
Okay, so we're back for the final stretch of our deep dive.
Time to put those finishing touches on that interview prep.
We've covered a lot of tough questions.
Yeah. Now it's all about making you super memorable to those hiring managers.
Like we've baked the cake. Now we need the icing.
Yes.
Make it look really presentable.
You got it. So you've got all the substance down, but let's make sure you're presenting it with confidence and professionalism.
Okay, so what are some of those final touches that can help us really stand out?
Well, first things first, you've got to do your research.
Yeah, always.
Take some time to learn about the specific hospital or healthcare system you're interviewing with.
Okay.
What are their values? What's their patient population like? Do they offer any specialized services?
Right.
It shows you've gone the extra mile.
Yeah.
You're genuinely interested in their organization.
And you know what? RoleCatcher can actually help with that.
Oh, yeah. How so?
They have this massive employer database with over 9 million records.
Wow.
9 million.
You can use it to get insights into the company's culture, their mission, even recent news and developments.
It's like you're getting a sneak peek behind the curtain before you even walk in the door.
Exactly. And remember, preparation is key for feeling confident.
Yeah, for that.
Practice those answers out loud. Maybe even do a mock interview with a friend.
Great idea. Or you know what? Try RoleCatcher's AI-powered interview practice tool.
Oh, yeah, I've heard about that.
It's seriously a game changer. You can actually record yourself answering questions and then get AI analysis on your delivery, your pace, your tone, even your body language.
It's like having your own personal interview coach.
Right in your pocket.
Amazing.
Okay, so we've done our research. We've practiced our answers. What else can we do to really make a lasting impression?
Don't underestimate those insightful questions.
Oh, yeah. You got to ask questions.
Absolutely. It shows you're engaged, that you're curious.
Yeah, and it gives you a chance to learn more about the role in the team.
Exactly.
Okay, so give us some examples. What kind of questions would really wow them?
Well, you could ask about the biggest challenges facing the pharmacy department.
Okay.
Or inquire about opportunities for professional development. You know, how you can grow within that role.
Right.
These types of questions show you're thinking long term.
Yeah.
You're eager to contribute to the team's success.
And guess what? RoleCatcher's AI can suggest tailored questions based on the job description and the hospital's profile.
No way. That's incredible.
It's like having a cheat sheet, but it's customized just for you.
So helpful. And of course, those basics are still important.
Like what?
Dress professionally, arrive on time, be enthusiastic and engaged.
Right, be yourself, but the professional version.
Exactly. It might sound simple, but those first impressions matter a lot.
Totally. It's all about showing them that you're serious about this opportunity and you're excited to join their team.
Now, before we wrap things up, I want to leave our listeners with something to think about.
Okay.
We've talked about how the role of a hospital pharmacist is constantly evolving, how important it is to stay up to date with technology, and how to showcase those skills in an interview.
Yeah.
So here's the question. As technology keeps advancing in healthcare, how do you see the role of the hospital pharmacist changing in the future?
Ooh, that is a great question to ponder.
Right. Will technology take over some of those routine tasks?
Freeing up pharmacists to focus more on patient interaction and personalized care.
Or will it create new challenges that need even more specialized knowledge?
It's definitely an exciting time to be entering this field.
It is. And with the right preparation, using resources like RoleCatcher and a forward-thinking mindset, you'll be ready for anything.
So true. Well, thanks for joining us on this deep dive into hospital pharmacist interview prep.
It's been fun.
We hope you learned a lot and that you're feeling super confident about acing that interview. Good luck with your job search, and remember, you got this.
We're rooting for you.